Hello, everyone. My name is Shelby Jones, and I am the program manager for the State Health Insurance Assistance Program with the Baltimore County Department of Aging. And we are here today to talk about the basics of Medicare. This presentation is also known as Transitioning to Medicare because it's really meant for people who are brand new to the Medicare program. So without further ado, let's get started. So I like to go over a few different terms and their definitions because I've noticed that with these terms, it's very easy to interchange them and get them confused. So the first term is coinsurance. That's an amount that you may be required to pay as your share of the cost for services after you pay any deductibles. Now you might be thinking, so what's a deductible? The deductible is the amount that you must pay for healthcare or prescriptions before original Medicare, your Medicare Advantage plan, your Medicare drug plan, or any other insurance that you have starts to pay. Copayments are something we are all pretty familiar with. That's an amount that you may be required to pay as your share of the cost for a medical service or a supply. This would be such as a doctor's visit or for a particular prescription. It is typically a set dollar amount rather than a percentage. Last but certainly not least is the premium. That is the periodic payment to Medicare, an insurance company, or a healthcare plan for your health or prescription drug coverage. If you are ever in a situation where maybe you need some clarification on a term that you heard, or you'd like more information about an acronym that you heard, because Medicare does have an awful lot of acronyms, I highly recommend visiting medicare.gov/glossary. This is a very user-friendly online tool to help gain that clarification that you need. I use it all the time and I highly recommend it. Now, this information is not exactly hot off the press, but I like to make sure that I share it anyway. We all hear about the marketplace, and it's one of those buzzwords, right? Well, I like to make sure that everybody understands. The marketplace is designed for people who are under the age of 65, who are not on Medicare, and who do not have group health insurance through an employer as a result of either themselves or their spouse actively working. Okay, so I just like to make sure we touch on that. Let's talk about Medicare eligibility because you might be wondering, so how do I become eligible for Medicare in the first place? So, in order to be eligible for Medicare, you must be a US citizen or have had your resident visa and have lived in the United States for 5 consecutive years and be 65 or older and receive or be eligible to receive Social Security or Railroad retirement benefits. Or you can have a spouse who meets this criteria. Or if you have been getting disability benefits for at least 24 months, or if you have been diagnosed with kidney failure, otherwise known as end stage renal disease or ESRD, or if you have been approved for Social Security disability with a diagnosis of ALS, otherwise known as Lou Gehrig's disease. Or if you have been approved diagnosis of ALS, otherwise Um, so let's talk about Medicare basics. There are two main parts of original Medicare. There's Medicare Part A and there's Medicare Part B. So Medicare Part A is everything inpatient. That's your hospital insurance. And Medicare Part B is everything outpatient. That's your medical insurance. For Part A, there's no premium if you or your spouse worked 40 quarters, which winds up being about 10 years of working and paying into Medicare taxes. But for Part B, there absolutely is a monthly premium, and it is $164.90 per month. And that's in 2023. It does typically change every year. Now, I do like to share this information again, even though it's not totally new. Back in 2020, every Medicare beneficiary was sent a new Medicare card to make sure that they receive their new Medicare billing identifier. So now, rather than your Medicare number being your Social Security number with a letter at the end, the new Medicare number has 11 random letters and numbers. So this is very, very important. Really, this was done to protect your privacy. As you can imagine, walking around with your Social Security number in your pocket is not that great of an idea, right? In the event, your purse or your wallet gets stolen, well, now they have your Social Security number as well. That's why this was changed. It was done to protect you. So please make sure that you are using your new cards. Now, is Medicare enrollment automatic? This is a great question. No, it's not. It's automatic only for those who are signed up for and who are currently receiving Social Security benefits due to age, or if you are eligible for and are receiving Social Security disability benefits. So, what happens when your Medicare enrollment is automatic? You'll receive a packet of information and your Medicare card 3 months before you turn 65 or 3 months before the 25th month that you've been receiving Social Security disability benefits. You'll be enrolled in Medicare A and B if you don't take any further action, and it will start the first day of the month that you turn 65 or the 25th month that you had been receiving disability benefits. So what about when it's not automatic? If you're not receiving Social Security benefits, you will need to contact the Social Security Administration 3 months before you turn 65 in order to apply for Medicare. That's the earliest you can start. Sometimes we have people who want to start 6 months in advance. I'm really sorry, you can't start that early, but you can certainly start getting your affairs in order. You can go online if you're applying only for Medicare A or A and B by visiting ssa.gov, which is the Social Security Administration website, or you can call the Social Security Administration at 1-800 772 1213. I will let you know that if you are calling the Social Security Administration, please be aware that they will not be able to assist you with enrolling in Medicare right then and there at the time of your phone call. They will schedule a follow-up phone appointment for you. And right now, I believe they're booking about a month to a month and a half in advance. So just keep that in mind. There's only one group who can delay enrolling at the age of 65 or the 25th month of disability. If you or your spouse is actively working and you have group health insurance through that employer, and the employer has 20 or more employees, you can delay enrolling at the age of 65. If you're under the age of 65 and you have a family member who is actively working and you have insurance through that employer has 100 or more employees, you can actually delay enrolling at the 25th month of disability. So let's talk a little bit about the initial Medicare enrollment period. It does last 7 months, so you have plenty of time to take care of this. And you would need to sign up during that 7 month initial enrollment period in order to avoid a penalty. And you might be thinking, well, how do I know if I need to sign up during the initial Medicare enrollment period? Could I be subject to what's called a special enrollment period? Let's talk about it. So if you meet any of the following criteria, you need to enroll during your 7 month IEP, or you will be subject to a penalty. So if you are not actively working and you do not have group health insurance through that employer with more than 20 employees, or 100 employees if you are under the age of 65, if you're on the expanded medical assistance, if you're on a qualified health plan through the exchange, if you are retired and have a retiree health benefit, if you're on COBRA, or if you are working as a contract employee without group health benefits for this employer. Okay, so if you meet any of the following criteria that we just discussed, you would need to sign up during your 7 month initial enrollment period. So it does start, as you remember me saying, it starts 3 months before you turn 65. It includes the month of your 65th birthday as well as the 3 months after. So if you sign up in the 3 months before your 65th birthday, Medicare will actually start the month you turn 65. So if you're trying to have your coverage start sooner rather than later, you want to enroll sooner rather than later as well. If you sign up the month of your 65th birthday, Medicare will start 1 month later. And if you sign up in the 3 months after your 65th birthday, Medicare will start the first day of the month after you sign up. So let's say, because it's right now, it's April. So if, let's say I turn 65 in April, and I sign up in May, right, the month after, my coverage would begin June 1st. So, what if I plan to work beyond the age of 65? This is really important, right? The workforce as a whole is aging. So, more and more people are choosing to work beyond the age of 65. If you meet that criteria, would you need Part A? If you or your spouse is actively working for an employer that has more than 20 employees, or remember, if you're under the age of 65, it's 100 employees, and they provide group health coverage, there's really no reason for you not to take Part A. But if you are under the age of 65 and on disability, you actually have to keep the A. If you've worked the 40 quarters or the 10 years and paid into Medicare taxes, you've already paid for the benefit, and Part A is premium free for you. And Part A would be secondary to the active employer benefit that you have and could wind up paying for something that your insurance doesn't cover. So, very important to remember. But there's one group out there who should not take Part A. If the employee health plan that you have is a health savings account with a high deductible health plan, you should not take Part A. This is because you can only continue contributing to your health savings account while you are not on Medicare. And beyond the age of 65, you have to stop contributing to your health savings account 6 months before you want Medicare Part A to start, or you will be subject to an IRS penalty. And nobody likes penalties. Now, whether or not you're contributing to the health savings account, you can still withdraw the funds to pay for Medicare and other health costs. So that's always good to keep in mind. But remember, this is only for people whose employee health plan is a health savings account with a high deductible health plan. So if I'm working, do I need Part B? Again, as I said, the workforce is aging. What do I do about Part B? Because that one comes with a premium. Am I supposed to pay two sets of premiums? Let's talk about it. If you are 65 or older, you can delay enrollment in Part B without fear of a penalty if you or your spouse is actively working for an employer, you have employer or union health coverage through that same employer, and the business has 20 or more employees. You'll notice these two scenarios come up throughout this presentation. Now, if you are under the age of 65 and receiving disability benefits, you may not need Part B because you have a family member who is actively working for an employer who has group health coverage and that business has 100 or more employees. If you don't need Part B, you can follow the directions on the back of your Medicare card to go ahead and decline the Part B coverage. Or if you're going online to sign up at ssa.gov, only sign up for Part A and save yourself the hassle. Let's talk about timelines. You heard me allude to the idea of a special enrollment period earlier. So let's talk about that, what that exactly means. So you can technically enroll in Medicare Part B at any time while you're still working and covered by employer group insurance. You will also have access to an 8-month special enrollment period in order to enroll in Part B without a penalty. And that's from the date that you no longer have group health insurance through your employer or union based on your active employment. So, the important thing to keep in mind with this is even though you have 8 months after you lose that health coverage, if you're running around with no health coverage, that's a little risky, right? So, just keep that in mind, because none of us have a crystal ball related to our health, and we want to make sure that we have health coverage. So just keep that in mind. Okay, so if you meet that criteria to enroll in Part B several months before you plan to retire, it's time to get your affairs in order. You need to go to cms.gov and you're going to download and complete two forms. We have the CMS 40B form and the CMS L564 form. The CMS 40B form is really for you as the Medicare beneficiary. That's saying, yes, I am ready to enroll in Medicare Part B. Next up is that CMS L564 form. This is for your employer. They are required to complete the information to verify that you have had the employer group health coverage continually since you started Medicare. Very, very important. So those two forms need to be presented to the Social Security Administration because that's really what enables you to sign up for Part B without worrying about a penalty. And we'll talk about what that penalty actually looks like. But first, let's talk about how to enroll in Medicare Part B. So, you really can't take the forms to the local SSA offices. You can send by certified mail to your local office. You can fax, and I will assure you that this fax number has been tested and it does work. It's 1-833 914 2016. And you can also complete the process online at ssa.gov. So if you would like to do it online, you can absolutely do it that way as well. So maybe you're in a situation where you say, "Hey, my employer can't sign the CMS L564 form. What do I do?" Well, where there's a will, there's a way, and there's always another way. You would just need to provide one form of secondary evidence showing that you had coverage since the age of 65. So some examples could be a pay stub showing that your health insurance premium was being deducted, or even a copy of your health insurance card with a start date. And that evidence needs to be included, whether the information is being mailed, whether the information is being faxed, or if you're going online, if you can't have the employer sign that form. Okay, so very, very important. No matter what, those forms need to be submitted. Now, what about who's primary? This is a great question related to coordination of benefits, and we get this question often. So here we go again. If you or your spouse is actively working for an employer with 20 or more employees, and you're covered by the employer or union coverage, the employer group health plan, that active employer benefit, is actually primary and Medicare is secondary. And if you're receiving Social Security disability benefits, the employer has 100 or more employees, that particular benefit would be primary and Medicare would be secondary. So it's the same structure. However, the day after you, your spouse, or family member stops actively working, Medicare becomes primary. Congratulations to you. And if you have a retiree drug or health plan, that then becomes your secondary insurance coverage. So maybe you're sitting there saying, well, the initial enrollment period got away from me because I was so excited about turning 65 and I was still working. And then the special enrollment period got away from me too. What can I do? When can I sign up? So you can actually sign up during the general enrollment period, and it runs from January 1st to March 31st every single year. And your coverage will actually begin, the month after you enroll. This is actually new for 2023, which is very exciting. It used to be that if you were signing up during the general enrollment period, that your coverage wouldn't start until July, which is a long time to wait. So this has been a very huge and very exciting improvement. Now let's talk about exactly what that Part B penalty looks like, right? I've alluded to it enough. So for each full 12-month period that you could have had Part B, but you didn't sign up for it, your Part B premium may be increased by 10% per month for as long as you live. Okay, very, very important. Sometimes in our office, we have people who say, well, I can't afford the Part B premium. And we will talk about financial assistance programs that are out there to assist with that. And people have elected to not sign up for Part B ever and just kind of take that risk. Um, the problem is typically what happens is once they are very sick, then they're saying, well, now I need to sign up for Medicare, but the penalties even higher than just what the premium would be, and you're sick, right? So then you have even more stuff going on. Just do yourself a favor and sign up when you are supposed to based on the guidelines I just gave. Nobody wants to have a penalty attached to their premium. So we're back at the Medicare basics because I really want to share more information about what exactly makes up Part A and Part B. And don't worry, I promise we will also talk about C and D as well. We're just getting started. So, under original Medicare Part A, as I mentioned, this is everything inpatient. This is our inpatient hospital care, skilled nursing care, home health care, and hospice care. Now, I already discussed that Part A is typically premium free. You just have to have 40 work quarters. But if you don't have the work quarters, you can purchase Part A. So if you worked between 30 and 39 quarters, it's $278 per month. And if you work less than 30 quarters, it's $506 per month. You have a lot of flexibility under Medicare Part A. You can go to any facility or provider that accepts Medicare. And this is some information about financially what you can expect to pay out of pocket for Part A hospital services. And this is specific to 2023. So there's a $1,600 deductible for hospital stays up to 60 days. Now, you see here, I say per benefit period, and you might be wondering, well, it's an annual benefit period, right? Because a lot of people hear the word deductible and they automatically think it's an annual deductible. For Part A, it does not work that way. The deductible for Part A is based on a 60-day period of time where you're not in the hospital. And that's kind of tough to grasp as well. So let's say I am admitted at the inpatient level of care, um, and I meet that $1,600 deductible, right? So I have to pay that. And then I get better. So I'm discharged. Great, wonderful for me. But then let's say 3 months later, 90 days later, I'm back in the hospital inpatient again. I have to meet that deductible all over again because there's been over a 60-day period of time in between admission number one and admission number two. Okay, so very, very important to know that. It's $400 per day for days 61 through 90, again, per benefit period. And it's $800 for each of your 60 lifetime reserve days. These lifetime reserve days are really there to help you extend your Part A benefit in the event, you have something catastrophic happen and you need to start dipping into those days. However, once you dip into those days, they do not replenish. That is where it will sit. So let's say I'm in the hospital for a very long time and I have to start dipping into my lifetime reserve days. And I go down from 60 to 57, but then I get better and I'm able to be discharged. Well, now those lifetime reserve days sit at 57, and then I can chip away from there as needed. Let's talk a little bit about skilled nursing stays in 2023. So it's $0 for the first 20 days of each benefit period, and then it's $200 per day for days 21 through 100 in a benefit period. But what is very, very important related to skilled nursing stays specifically is that in order for Medicare Part A to pay for you to be cared for in a skilled nursing facility, you need to have been admitted to the hospital at the inpatient level of care for 3 midnights. That does not include any time that you spent in the ER or if you were being treated at the observation level of care, because both of those things are covered under Medicare Part B. And you might be thinking, well, how am I supposed to know if I'm inpatient or observation? That's a great question because it's almost impossible for somebody to know without being told. You can be at the observation level of care in a room for several days. Okay. And it's really, really challenging as a consumer and a patient to know the difference, which is absolutely understandable. So, because of that and those challenges, the Medicare Outpatient Observation Notice was established. This is also known as the MOON. And essentially, this is a requirement that all hospitals have to give their patients or their representatives notification that they are being treated at the observation level of care. Because how are we really supposed to know, right? So, you, as the patient or your representative working on your behalf, is required to sign that form in order to indicate that you received it and that you do understand what it means. And really, the goal is to keep you informed, which is really important, right? We have to be our own advocates, right? And our representatives working on our behalf also are there to advocate for us. But we can't do that without having the proper information. So they want you to be informed about cost sharing. Part A is more expensive than Part B, right? Inpatient level of care is more expensive than outpatient level of care. And also, they want you to understand in the event you were to be transferred to a skilled nursing facility care, because that is the level of care that you were deemed as needing and what was deemed as being medically necessary for you. If you had only been treated at the observation level of care, even if it was for 3 days and 3 midnights, it doesn't matter. Part A wouldn't cover it. Okay. So just keep that in mind. Very, very important. So let's talk a little bit about Medicare Part B, right? All of the outpatient good stuff. So this covers doctor services and outpatient care from any provider who accepts Medicare. Again, lots of flexibility here. This includes preventative services, diagnostic tests, which there is a difference between those two things, and we'll go into that more. Some therapies like physical therapy, occupational therapy, and speech, home health, durable medical equipment, which is also known as DME. That's things like wheelchairs, walkers, hospital beds, things like that. And we already talked about the $164.90 monthly premium for 2023. Now, your premium can actually be higher if you make over a certain income threshold. So, if you are a single individual making over $97,000 per year, or a married couple with a combined income of over $194,000 per year, you will be subject to what's called an income related monthly adjustment, otherwise known as an IRMA. Now, if you're curious how much higher your premium will be, I recommend that you visit the Social Security Administration website. They have it broken down so you can actually see how much and how high it will be adjusted based on your income. Now, I always like to share new coverage when I can. So let's talk about some new coverage under Medicare Part B. You can actually get acupuncture now, which is very exciting, but it is only to treat lower back pain. You can receive up to 12 sessions in 90 days with an additional 8 sessions if you demonstrate improvement. Very exciting. Also, your methadone clinics, which are opioid treatment programs, they do need to be enrolled in Medicare, and there's no 20% coinsurance once you meet your Part B deductible, which in 2023 is $226. And that is an annual deductible. And these are just two examples, Northern Parkway and Concerted Care, that have been approved. Now, this coverage is actually brand new. So I like to make sure that I share this because it is something that has changed since the COVID-19 pandemic. So when the public health emergency first began, it was determined, I believe, back in 2022. So it's been about a year that Medicare beneficiaries have been able to receive up to 8 over-the-counter COVID-19 tests per month for free through Medicare. Well, once the public health emergency ends, that benefit is actually going to stop. So you will no longer be able to get the 8 over the counter COVID-19 tests per month for free from Medicare at local pharmacies. So please keep that in mind. Now, also, when the public health emergency ends, though, this is important. If, let's say, you go to the doctor because you're not feeling well and you have a test ordered by your doctor, that is still covered under Medicare and there's no cost sharing for that. If you're somebody out there who's listening, who's enrolled in a Medicare Advantage plan, or you're thinking about enrolling in a Medicare Advantage plan, you should contact the plan to determine the COVID-19 test coverage benefits, okay? Because they do change depending upon the plan that you're in. So very important to contact your plan directly about that. So I did mention that for Part B services in 2023, there's a $226 annual deductible, and then there's a 20% coinsurance for most of your Part B services if your provider accepts assignment. I'm going to expand on that more in just a second, but first I like to make sure that I let people know there's actually a really fabulous app that is available from Google Play or the App Store. You can download it to your smartphone if you're like me and you have your smartphone on your person at any given time. I have my phone on me not only because I have small children, but because I believe that knowledge is power and I love having information at my fingertips. You can download this app and you can learn about what items and services are and aren't covered by Medicare A and B. You can learn about general costs, eligibility details, and how and when and how often you can receive these covered benefits because they really are benefits to you. Very, very important, especially when we're talking about preventative services. You want to know what you are able to get and how often you are able to receive those services. So, highly recommend checking out the app. But let's go back to this idea of assignment. So, a doctor or provider who accepts assignment and participates in Medicare is agreeing to accept the Medicare approved amount for a service or item as the payment in full. Now, you might be thinking, that was a lot of words. What does that mean? So, this is really that 80/20 rule that we hear an awful lot about related to the Medicare program. Medicare pays 80%, you, as the beneficiary, is billed for 20%, you reach 100%, and then we just hope everybody's happy, right? Well, there's also doctors out there who accept Medicare, but they don't accept assignment. So you might be thinking, so what does that mean? That makes them a non participating doctor. Not that they're not participating in Medicare at all, just that they don't accept the Medicare approved amount as their payment in full. And you might be wondering, okay, so how does that impact me, right, as the beneficiary and the patient? Well, these providers can actually charge you as the patient and the beneficiary up to an additional 15% more, okay, than the Medicare approved amount. So in addition to your 20%, you will also be responsible for an additional 15%. Very important. Sometimes these providers will also have you pay the entire claim up front and then seek reimbursement from Medicare after the fact. So that's also something to be aware of. There are providers out there who completely opt out from the Medicare program. That means that they don't accept Medicare at all, and you will be responsible for the entire cost, and Medicare will certainly not reimburse you. This notion of a concierge or boutique doctor is relatively new, but I think it's becoming more prominent. These providers can definitely be Medicare approved providers who accept assignment, but they can offer services that are considered boutique services, such as access to, let's say, their personal cell phone number for a price. Whatever you were to pay to have access to their personal cell phone number, 24/7 access to my doctor, why not? Maybe for some people that's priceless. Um, Whatever you were to pay, that would not be something that would be covered under Medicare, which understandably so because it's a boutique service. So just keep that in mind. Very, very important. Now, assignment is also related to durable medical equipment, prosthetics, orthotics, and supplies, otherwise known as DemiPose, because that is an awful lot to say. So in Baltimore County, excuse me, if you want Medicare to pay their 80%, you need to see a Medicare contract supplier in order to purchase over-the-counter back and knee braces. So a lot of people get phone calls saying, um, hi, I'm calling from Medicare. Red flag number one, Medicare doesn't call its beneficiaries. And number two, if you're on the phone long enough to hear what these people have to say, they'll likely say, oh, you're entitled to a free or at little to no cost to you, back, knee, arm, whatever kind of brace, you name it, they have it, allegedly. Um, those people are scammers, and you should hang up the phone and report those folks to Medicare. Okay. Um, Nothing is free. And if it sounds too good to be true, it probably is. So just remember that even if you were to never receive that piece of equipment from that scammer, Medicare was likely still billed for it. Okay, so that's something to be aware of. Now, if you have a provider who does not accept assignment for that particular DME item, there's no limit as to how much the price may be raised. So it's not like what we were just talking about previously with a doctor's visit, just a regular old doctor's visit. If that doctor doesn't take assignment, well, that just means you'll be charged an additional 15% more. If it's specific to a DME item, no limit. Okay, very important to do your research. If you're looking for a reputable DME supplier in your area, I recommend visiting medicare.gov/supplier. It is a very user-friendly tool. I believe you put in your zip code and it'll show all of the DME suppliers in your area. So very good to know. So let's talk a little bit about preventative services and diagnostic tests, okay? Because there is a difference between the two. So for preventative services, they're really when you don't have any prior symptoms of a particular disease. But Medicare may cover the test if you have certain risk factors for preventative screenings. Now, for diagnostic services, they're really addressing symptoms or conditions that you already have. Now, diagnostic services will typically require a payment of copays, where preventative screenings usually don't have additional copays. But it is absolutely possible for you to go in for something thinking that it is preventative in nature and then have it turn into diagnostic. So, an example that I will use is a routine colonoscopy. Otherwise, you're not having any issues, but a polyp is found while you are in the procedure. So that procedure just turned from preventative to diagnostic. So very important to be aware of. This is not an exhaustive list of preventative services, so please be aware of that. But let's talk about some of the preventative services that are covered under Medicare Part B. We have our Welcome to Medicare visit, as well as our annual wellness visit, but neither of these things are an annual physical exam. You'll see why in just a second. Part B also covers your flu shots as well as both types of your pneumonia shots, bone mass measurements if you have risk factors, lung screenings, diabetes screenings if you have risk factors, mammograms, as well as pap smears, pelvic exams, and breast exams every 2 years if you are at a low risk for cancer, and every year if you are at a high risk for cancer. Always good to know what preventative services are covered. And please, these preventative services are here for you to utilize. So please use them. Let's talk about what Medicare doesn't cover. So, just a minute ago, you heard me say that the annual wellness visit and the Welcome to Medicare visit are not the same thing as a physical exam. That's because physical exams are not covered under original Medicare. This also goes for exams that are requested by a third party, such as your work. That would not be covered under Medicare either. Long-term care is not covered under Medicare. Routine dental care and dentures, not covered by Medicare. Hearing aids and exams for fitting hearing aids, not covered. However, I believe that hearing aids are now available over the counter. So that's something to be aware of. Routine eye exams and glasses, not covered by Medicare. Acupuncture, as I mentioned, isn't covered if it's for anything other than lower back pain. And last but certainly not least is cosmetic surgery. Medicare does not cover cosmetic surgery. Hopefully, I didn't make anyone shed a tear over that last one. You might be thinking at this point of the presentation, wow, there are a lot of out of pocket costs that are associated with the Medicare program. What can I do to help myself, right? So let's talk about ways that you can decrease out of pocket expenses. We have Medicare supplement plans, which are also known as Medigaps, and Part D prescription drug plans. But first, let's touch on retiree health benefits, just in case anybody out there will have a retiree health benefit. They're secondary to Medicare the day after you stop working, as I mentioned before, and they can really be offered by all sorts of different entities. Whether you work for a private company, if you work for the city, the state, the feds, you might have TRICARE, benefits through the VA. There are a plethora, if you will, of retiree health benefits. I always tell people if you have questions about how your retiree health benefit works with Medicare, and even if you don't, even if you think you know everything about your retiree health plan and how it works with Medicare, please just call your benefit administrator to make sure that you really do know how your specific retiree health benefit works with Medicare. Every year during the open enrollment season, which we'll talk more about later, it happens in the fall from October 15th through December 7th. We actually have a lot of people that come to see our office who are in retiree health benefits, but we don't have the information on their specific retiree health benefit. That's all done through the benefit administrator. Okay, very, very important. If you were to have a retiree health benefit and sign up for a Part D prescription drug plan because you thought you had to, maybe you saw all the commercials, radio ads, and mailers during open enrollment, and you said, oh, I guess I need a prescription drug plan. If you signed up for one of those, you could actually lose your entire retiree health benefit, even though it was an innocent mistake. So please, I cannot say it enough, talk to your benefit administrator. Let's talk a little bit about these Medicare supplement plans. So they're also known as Medigaps. They're completely separate and different from Medicare Advantage plans, which I'm sure we have also heard a lot about. So the Medigaps range from letters A to N, and each lettered plan covers a different mix of Medicare deductibles and costs. So you might be thinking, what exactly does that mean? I like visuals, so I'm going to fast forward just for a second. This is actually a snapshot from the Medicare Supplement Premium booklet that is put out twice a year by the Maryland Insurance Administration. Here you'll see we've got Plan A, Plan B, Plan D, G, K, L, M, and N. Now, I can assure you I know my alphabet, but you might be thinking, well, how come you didn't say C or F? Great question. So, Plan C and F are broken out over here, and you might be wondering why that is. If you turned 65 prior to January 1st, 2020, you are actually still eligible to get the C or F plan. If you turn 65 after January 1st, 2020, you are not eligible for the C or F plan. So what that means, basically the difference between these plans and the plans on the left is that now for anybody new coming on to Medicare as of January 1st, 2020, coming on to, as of turning 65, I should say, you are responsible for that annual Part B deductible, that $226. That's why across the board here, that's something that is not checked at all. Whereas you'll see for the CNF plans, it is checked. So just be aware of that. But one important piece of information related to the Medigaps is that these plans are actually standardized. So let's say, I'm going to fast forward again. I turn 65 tomorrow. And I know, I really want a G plan. Maybe some family members, friends have the G plan. They're really happy with the coverage. Looks like it checks a lot of boxes, which is great. Pretty comprehensive coverage. Good stuff. But as I'm doing my research, I might notice that there are 30 different insurance companies offering G plans, and they all cost different monthly premiums. So you might be thinking, how do I know what to pick? Some people pick based on having that particular insurance plan at one point in their life. Some people might say, oh, that's a name that I trust, or maybe other people might say that one's got the lowest cost. So the important thing to remember is if you are comparing one G plan to another G plan to another G plan, even with all the different premium rates, they are all the same product. Okay. It's all the same because those plans are standardized. So just be aware that when you lock in to a Medigap, you're really doing so for the long haul, which is very important to consider because also you're not locking in at that premium rate for the rest of your life. That premium will go up. Okay, so very, very important. If you'd like to get a copy of the Medicare Supplement Premium booklet that I was chatting about from the Maryland Insurance Administration, you can give them a call at 410-468-2244. Now, these policies are written based on attained age, issue age, or community rated. There's only one insurance company for Medigaps that is community rated, and that is AARP, United Healthcare. As you can imagine, I won't say all, but most people out there likely know who AARP is as a company. So they have the largest pool of participants. Medigaps also don't make separate coverage decisions from Medicare. So if Medicare says, nope, that's not covered, your Medigap is not going to swoop in and help. They're going to say, yeah, what they said, right? They're going to agree with Medicare. Okay, we talked about this. Now let's talk about, this is called the initial enrollment period for Medigaps, but I like referring to it as the guaranteed issue period because that's really what it is. So this is the first 6 months that you are on Medicare Part B. You can purchase any Medigap that companies sell. Okay. So if you have, let's say you're in really poor health, it doesn't matter during that guaranteed issue period. The companies cannot refuse to sell you a Medigap or charge you more than someone who doesn't have health problems. Very, very important. So if you're someone who does have health problems, you certainly do not want to dilly-dally with your Medigap coverage. You want to make sure that you find a Medigap that works for you, whether it's financially and it checks all the boxes that you want it to check, and you go ahead and enroll. Very, very important. Now, there's no open enrollment period for Medigaps like there are for prescription drug plans and Medicare Advantage plans. Once you are outside of that initial 6-month window, which is called, again, the guaranteed issue period, Medicare supplement plans can and will use medical underwriting in order to determine if they will sell you a policy at all, and if they are going to sell you a policy, how much it's going to cost. There's no impact with Medigaps from the Affordable Care Act. So please, please, please act within that 6-month period that you are given, because you don't want to be trying to shop around and have everybody deny you, right? That's not going to be fun. Now, if you are on Medicare due to having a disability, again, you still have a guaranteed issue period. It's the first 6 months that you're on Medicare Part B, but companies are only required to sell plans A or D to those who are under the age of 65 if they're offering those plans to people who are 65 and older. The premiums, though, are going to be much, much higher. But one thing to consider is that when you do turn 65, you're what I call clean slated. So that means you can basically have a new guaranteed issue period for 6 months now that you turn 65 to say, I'm getting rid of my very expensive A Medigap and I'm going to hop into the G Medigap for a lower premium and more coverage. Okay, so very, very exciting and very important to know. We talked about that already. So let's keep moving through the alphabet and talk about Medicare Part C, also known as Medicare Advantage plans. A lot of people don't realize, and I think part of it is because of the commercials and things that are out there. Some use Medicare Advantage plans, some use Part C, and it gets very confusing to know that they're actually the same thing. So I call this completing the alphabet, because in order to be and enroll into a Medicare Advantage plan, you have to be on A and B first. So you have to be on A and B in order to get C, okay? Now, these plans act as a substitute to original Medicare A and B. So if you're in a Medicare Advantage plan, that is where you are getting your services through. So while you're still technically in Medicare, you would use the Medicare Advantage plan card at the time of service. So if you're in Kaiser, you need to make sure you hand them your Kaiser card. If you're in a Hopkins Advantage plan, you need to make sure you give them that card. Very, very important. All of the plans out there offer prescription drug coverage except for LASSO, which is it's set up differently. We'll talk about LASSO. They can include extra benefits, which you have likely heard on commercials, but you really need to read closely about what exactly is covered. Sometimes they can offer benefits like dental, vision, and hearing, as well as the coveted routine physical exam. But again, each plan is different, so you want to make sure that you are aware of what your particular plan, what they cover. They also typically have low premiums because they're subsidized by the federal government, and there are typically co-pays for each of your services. There is a cap on the out-of-pocket expenses, though. Before you sign up for a Medicare Advantage plan, please check with your doctors, all of them, specialists, everybody, to make sure that they participate with the plan that you are considering enrolling in. Sometimes what we find happens is people say, oh, I checked the website and it says my doctor takes Cigna, so I enrolled in the Cigna Medicare Advantage plan. Cigna Medicare Advantage is totally different from regular old Cigna because that's a really big umbrella. So what I recommend that you do, find a plan that looks good, check the hospitals, as you see I have listed here, what hospitals participate with the plan. And if you like that, your drugs are on the formulary, call your doctors, okay, and say, hey, do you take this particular Medicare Advantage plan? Because I'm thinking about signing up. But remember, the doctors can decide every single year if they're going to continue accepting Medicare Advantage plans, or they may change what Medicare Advantage plans they accept. Hospitals can also do this as well. One change to 2023 is that GBMC used to be a Kaiser hospital, but it's actually no longer a Kaiser hospital as of this year in 2023, and now it's one of them is St. Joe's. So just something to be aware of. If you do enroll yourself in an HMO, Medicare Advantage plan, you have to stay in network and you need referrals to see specialists typically. If you're in a PPO, you can go out of network if the provider accepts that plan, but you're definitely going to pay more money. When you see PPO, a lot of people think, oh, yeah, that's a lot of flexibility. But with the Medicare Advantage plans, if you really look closely, let's say you were going to your primary care doctor and they were in network at a PPO, you might have, let's say, a $20 copay. Okay, great, fine. But if your primary care doctor is out of network and they'll still accept that Medicare Advantage plan, you might be paying 40%. Okay. So just keep that in mind because that's going to be a big difference. There are what's called special needs plans out there for beneficiaries, and they are Medicare Advantage plans. So there are special needs plans that are designed for those who are chronically ill, as well as for those who are on QMB and medical assistance. So Cigna Achieve HMO is meant for people who have diabetes. And there's also a new one to Baltimore County in 2023. It's called Communicare. And I believe it's for folks who are diabetics, but also who suffer from heart failure, if I'm not mistaken. Um, the special needs plans for those who are on medical assistance and QMB, or the Qualified Medicare Beneficiary Program, those folks are considered dual eligible because they are both on Medicare and Medicaid. So there's a few listed here. We've got Cigna Total Care. There's a Care First Dual Special Needs Plan. There's an Alterwood Dual Special Needs Plan, as well as a United Healthcare Dual Complete Special Needs Plan. Okay, so there's a couple different ones out there, but you also want to check to make sure that your medications are on the formularies, that your doctors, take them. All very important. The rules still apply there. Let's talk about the Medicare Advantage trial right. When you were first eligible for Medicare when you turned 65, if maybe you heard from family member or friends how much they really like their Medicare Advantage plan, um, and you decided, okay, I'm going to hop into that. Sounds pretty good. But within the first 12 months, you realize, this really just isn't for me. You can actually go back to original Medicare within that 12-month period and have a guaranteed issue period to purchase any Medigap that is sold in Maryland. And that can start, the guaranteed issue period will start as early as 60 days before the date your coverage will end, but it won't last longer than 63 days after your coverage stops. Okay, so very important to be aware of that. So I mentioned that we talk about Lasso a little bit later. Lasso is one of these Medicare savings accounts. And a lot of people say, well, who's signing up for a Medicare savings account? Because the structure is very different from what we've discussed previously. If you had a health savings account while you were working and that's the structure you're used to and you like it, you're probably going to sign up for a Medicare savings account because that's the structure that you're used to and you like it. Okay. So this is when Medicare deposits, depending upon what plan you have, $2,000 or $3,000 into your account. The deductible is $5,000 or $8,000, and then your beneficiary responsibility is $3,000 or $5,000. That particular Medicare savings account and your own money is what's going to pay for your Medicare A and B costs until you meet that deductible. Okay. And then once you meet the deductible, there's no cost sharing for the remainder of the year for your Medicare covered services. Maybe you don't go to the doctor that much, or the hospital, you're pretty healthy. If you have unspent funds, you can actually roll them over to the next year. You still need to see participating providers, and if not, you pay an additional 15%, but that is not counted towards your deductible. You still need a Part D prescription drug plan, which I know I've talked a little bit about them, but I haven't described them. Don't worry, it's coming. And you can use your Medicare savings account funds to pay for IRS qualified medical expenses. But if they're not covered by Medicare A and B, they will not apply to that deductible. Okay, very, very important. So are reaching the end of the alphabet. So let's talk about Medicare Part D and the enrollment periods associated with Medicare Part D. I've talked a little bit about them already. So we already chatted about the initial enrollment period. This would be for Part D and Advantage plans. It's the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after, or these timeframes can be based off of the 25th month of receiving Social Security disability benefits. There's also an annual open enrollment period for Part D and Advantage plans, which is very important to be aware of. If you have television, you will certainly not know about it because there are commercials probably every 5 minutes going on about Medicare Advantage plans as well as the open enrollment period and the importance of it. So the annual open enrollment period actually runs from October 15th through December 7th every year. During this time, you can join, drop, or switch Part D or Advantage plans. And any changes that you make in the fall during that period of time become effective January 1st. So, your Medicare prescription drug coverage can be offered through the Medicare prescription drug plans, which is Part D. Medicare Advantage plans can also offer prescription drug benefits, and most of them do, but Medigaps do not include prescription benefits. Just like with Part B, there is a late enrollment penalty for Part D. People who wait to enroll in a Part D plan and who did not have creditable coverage, which is considered as being at least as good as Medicare drug coverage, would be um, susceptible to having a penalty. And the penalty is 1% of the national base premium, which is $32.74 this year in 2023, for each month that you were eligible but not enrolled. So if you have several years where you were eligible, didn't enroll, and didn't have creditable coverage, well, you're going to have a pretty nice penalty added to your premium. You would pay that penalty as long as you are enrolled in the drug plan. Now, this slide always cracks me up because it says Medicare Part D basic structure, but at first glance, this does not look very basic. I'm going to do my very best to describe it, I promise. So, the deductible for most Part D plans in 2023 is $505. After that, you have the initial coverage area, followed by the coverage gap, which is also known as the donut hole, and then catastrophic coverage. So the initial coverage area is between $505 to $4,660 in total drug cost, not what you have put out of your own pocket, total drug cost. During that time, you as the beneficiary is tending to pay less than 25% of retail costs for brand name drugs and 0 to 100% of retail for your generics. So let's say, you've met that 4,660. So now you switch into the coverage gap or the donut hole. During this period of time, beneficiaries pay 25% of retail for generics and 25% of retail for brand name drugs. Okay. So you can absolutely notice in the switch from the initial coverage area to the coverage gap that all of a sudden your prices have increased. Because if you were paying less than 25% for brand name drugs and under 25% for generics during the coverage area, the initial coverage area, well, now in the gap, you're set at 25% for each. So you will definitely can see and notice an increase at the pharmacy. And you would be in that coverage gap until you reach $11,206 again in total drug cost, not what you've put out of your own pocket. Once you reach that, you have reached catastrophic coverage. You're going to pay 5% or less for very low cost drugs, $4.15 for generics, and $10.35 for brand. So let's talk a little bit about the donut hole and the coverage gap area, because a lot of people still use those terms interchangeably, which is okay. But technically, that donut hole did close because as of 2020, now beneficiaries are paying 25% of retail for those brand and generic drugs. Whereas it used to be that you really weren't getting any assistance, okay? And it would be very, very expensive for people. Manufacturers are paying 70% of retail for the brand name drugs while you're in that coverage gap area. And that is actually counted toward your out of pocket costs. So you're going to hit catastrophic coverage sooner than it appears. A lot of people fixate on these numbers, the $11,000, the 4,000. Again, that's not what you're putting out of your own pocket. The actual out of pocket expenses to reach catastrophic is about $3,200 in 2023. So just kind of keep that in mind. In 2023, you actually have 22 standalone Medicare Part D plans. You might be wondering, well, how do I decide which one to choose? I'm going to tell you. The premiums are as low as $7.60 per month and as high as $112 per month. Most of your plans do have a deductible. The majority are at the $505. Some are lower, and there's a couple plans out there. I think there's 3 that don't have any deductible at all. But the prescription drugs that you as an individual takes is really what determines the best plan financially for you. And these plans absolutely do change every single year. So it is so incredibly important during that open enrollment period to take a look. Put your medications in the Medicare Plan Finder on Medicare.gov and say, hey, it looks like my WellCare plan actually isn't the least expensive anymore. Now, maybe it's Cigna. Okay, so very important to be aware of that because if you just keep staying in the same plan, you could really wind up spending a lot more money than you need to. I highly, highly recommend setting up a Medicare.gov account for yourself. Again, you can use Medicare.gov to conduct research about Medicare Advantage plans if you're interested, or, each year to see how the Part D plans have changed. And you can enroll yourself in Part D or Advantage plans. You can print copies of your Medicare card, pay Part B premiums online, review claims, which is very important when we're talking about fraud, which we will talk about later. And there's also a chat function if you have a quick question you wanted answered. Let's talk about some restrictions related to Part D, though. So, drugs can be subject to a couple things. Some prescriptions can be subject to prior authorization. Some drugs can be subject to step therapy, which gets a little complicated. But if you have a drug that is subject to step therapy, you're required to try a less expensive medication before your drug plan will pay for the formulary drug that you were originally prescribed. So, very good to be aware of step therapy and if that's going to impact any prescriptions that you take. Also, quantity limits. You definitely want to know if the way that your prescription is currently written is going to be outside of the quantity limits that are listed and given by your Part D plan. Very important. I think my personal favorite quantity limit that I've ever seen is that you can't get more than 30 inhalers in 30 days. And all I could think of was, wow, if you need 30 inhalers in 30 days, whew, you might want to have a conversation with your doctor. So sometimes also I think that those quantity limits are really there to protect you because if somebody's putting in something for 30 inhalers for 30 days, that might cause some red flags that something's not actually entered correctly. So keep that in mind as well. And again, as I mentioned, you really want to check to make sure and see, hey, is the plan I'm considering, are they going to require prior authorizations? Do the quantity limits impact the medications that I'm on? All very, very important to be aware of before signing up for that plan. Mid-year formulary changes are also something that can happen that a lot of people don't realize. So, Medicare Advantage plans and the Part D prescription drug plans are actually able to immediately substitute newly available generics for brand name drugs if they're on the same or lower cost sharing tiers without notifying you. Okay, they don't have to notify you. Some plans use just general notices to say, hey, we are going to possibly be conducting a mid-year formulary change, and that might be all that they say. If they do this, keep that in mind, very important. That particular plan would be required to provide a 30-day supply of the brand name drug upon your request. Used to be a 60-day fill, but it's not anymore. Then the beneficiary, you, would need to seek what's called a formulary exception, and you may or may not succeed. Okay, so very important to be aware of that. All right, we are going to chat about the financial assistance programs that are out there, and then we're going to touch on fraud. And then I will tell you how you can get in touch with the SHIP office if you have any questions. So let's talk a little bit about Extra Help. So Extra Help is a federal financial assistance program administered by the Social Security Administration, and it's really meant for folks who have a low income, who are on a Medicare Part D or Advantage plan. What it does is it's going to assist with your costs of your Medicare Part D premiums, deductibles, and copayments, or if you're on a Medicare Advantage plan, it will assist with the prescription drug portion of your plan, those specific premiums, deductibles, and copayments. You can apply online at ssa.gov, which is a very easy process to conduct online, or you can call Social Security and apply over the phone. But they are going to see if you are eligible, because right now there's two different types of extra help. That will be changing in 2024. But for now, there's partial extra help and there's full extra help. So for partial extra help, if you were deemed eligible by Social Security, you would you would receive a partial payment of your Medicare Part D premium, and that's done based on a sliding scale. Your deductible would be capped at $104. The drug copayments would be 15% of retail or less, and because of that, you don't have to worry about the donut hole coverage gap area. Now, in order to qualify for partial extra help as a single individual, the income maximum can be no more than $22,110 per year, and your assets have to be under $16,660. Now, a married couple would have to have a combined income under $29,820 per year, and your assets combined would have to be under $33,240. Now, I'm going to stop here very quickly because a lot of people have questions about assets. They think, oh, well, I own a home, so that counts me out. It actually doesn't. One home and one vehicle do not count against you. So please don't think that you wouldn't qualify for this program because of something like that. However, when you are applying for these programs, they do want to know, do you have additional vehicles? Do you have additional property or residences? Do you have stocks, bonds, IRAs, checking accounts, savings accounts, cash just sitting around at your house? They want to know that information because really they need to make sure that this program is being utilized for those who are truly eligible. Let's talk a little bit about full extra help. So for full extra help, you would typically have no premium, you would have no deductible, your generics would be no more than $4.15 per month, and your brand name drugs would be no more than $10.35 per month. And again, because of all that, you wouldn't have to worry about the donut hole coverage gap, which is great. Now, in order to qualify for full extra help, the income and asset guidelines do change. So for a single individual, your income maximum can be no more than $19,923 per year, and your assets need to be under $10,590. If you're a married couple, the income maximum can be no more than $26,862 per year, and your assets have to be under $16,630. And again, asset criteria is the same. If you are deemed eligible for extra help, whether it's partial or full, you can actually change your Part D or Advantage plan once per calendar quarter during the first 9 months of the year and then during open enrollment as your fourth quarter. Now, you might be thinking, well, why would I want to change? Well, remember, we make changes in the fall, right? Between October and December for the coming year. What if January hits and your doctor puts you on a new prescription that does not play nice with your plan? Well, it's really nice to have the opportunity to see if there's another plan out there that would financially benefit you based on all of the, new drugs and old drugs, everything, all of the prescriptions that you take. And if you have that opportunity, take it. There's no sense in paying hundreds or thousands of dollars more than you have to if you are in extra help and you have the ability to change plans. Let's touch base on the Maryland Senior Prescription Drug Assistance Program. In our office, we call it SPDAP. S as in Sam, P as in Paul, D as in dog, A as in apple, P as in Paul. It's just the acronym, and it's a little bit quicker for us to say. It is a state of Maryland benefit. So for this particular benefit, you do need to provide proof of Maryland residency for at least 6 months. They look at income, but they don't look at assets. So for a single individual, the income maximum is $43,740 per year. And for a married couple, it's $59,160 per year. The benefit of this program is that they will actually pay up to $60 per month towards your Part D premium costs, which is very, very helpful, right? If we look at $60 over the course of a year, well, that's really nice to have that money back in my pocket. Um, it also, participation in this program also enables you to enroll in a Part D or Advantage plan one time outside of open enrollment. So again, if you're in a situation where your prescription drugs change during the year, and you obviously weren't anticipating that, and maybe those drugs don't play nice with your current Part D plan, you can see, hey, is there a better plan out there for me that works with everything and would save me some money? And if it does, you can change because you're in the SPDAP program. It is a paper application for this particular program. And if you're a married couple, you need 2 separate applications. A lot of these applications, like with extra help and with the programs we're about to talk about, you can do spouses together. So let's talk about the QMB program. This is something I talked about briefly earlier when we were talking about the Medicare Advantage plans, specifically the special needs plans. So QMB stands for Qualified Medicare Beneficiary. If you are deemed eligible for this program, you would actually receive a gray and white paper card. And if you do receive that card, it's very important that at the time of service, you show your doctor your red, white, and blue Medicare card and your QMB card because it's processed like medical assistance. It's a state benefit administered through DSS, the Department of Social Services, and they do look at income and assets. So for a single individual, the income maximum is $14,820 per year, and your assets have to be under $9,090. For a married couple, the income maximum is $19,956 per year, and your assets have to be under $13,630. QMB offers an extremely comprehensive benefit to those who need it, right? So the state will pay for your Medicare Part B premium, which is huge. That's $164.90 right there. They'll cover all of your co-insurances, co-payments, and deductibles that are associated with original Medicare or your Medicare Advantage plan. And they will pay your Part A premium if you didn't work the 40 quarters, which, as we saw at the very start of this presentation, can be very, very expensive. I like to call this the sister program to QMB. This is called SLMB, the Specified Low Income Medicare Beneficiary Program. It's still a state benefit through DSS. They still look at income and assets, and actually the asset levels remain the same for both QMB and SLMB. It's only the income levels that change. And for SLMB, it actually goes up. So for a single individual, looking to qualify for SLMB, your income maximum can be no more than $19,920 per year. And for a couple, it's $26,868 per year. And as I just said, the asset levels stay the same between QMB and SLMB. Now, the benefit of SLMB is less comprehensive than QMB, but still extremely helpful. The state will actually pay for your Part B premium. So again, that $164.90 every single month you wouldn't have to worry about, which is a great thing. But you would not if you only qualify for SLMB, receive any assistance with Medicare copayments, coinsurances, or deductibles. I do like to press pause and just tell people, if anybody out there listening is on a Kaiser Medicare Advantage plan and you're finding that you're having trouble and you're struggling paying the co-payments at the time of each service, please call Kaiser, because they actually have a foundation that's built to assist their members with the payment of co-pays, because it can add up. So definitely, if you can use that resource, please do. Last but certainly not least, I want to talk about fraud. Fraud is the intentional deception or misrepresentation made knowingly and willingly in order to secure some unauthorized benefit. And abuse is engaging in practices that are inconsistent with accepted medical or business practices. I always tell people that really, you as the beneficiary and as the patient, you are the first line of defense against Medicare fraud. You are the only person who's going to know if you received the services that were billed to and paid for by Medicare. You might be thinking, well, my Medicare summary notice only comes to me quarterly. How am I supposed to remember? Record, review, report. Those are the 3 R's related to Medicare fraud, waste, and abuse that are so incredibly important. Take a journal with you. Take a notebook with you when you go to the doctors and when you pick up prescriptions. Write down exactly what happened. Maybe you're getting home health care. Jot down exactly what happened. That way, when you get your Medicare summary notice and you review it, that second R, you'll know, yep, everything looks right. I did have this done by my doctor. I did have that test done that day. Physical therapy did come twice that week and it's billed twice. Or what if, it actually caused you to raise some eyebrows saying, well, physical therapy was only here twice. How come they're billed 4 times? What's going on? And last but not least, report. If you see something, say something. Um, so much money is lost every single year to fraud, waste, and abuse within the Medicare program alone. And it is so incredibly important that we, as the consumers, act. Okay. So important. Um, Never ever hesitate also to call your doctor, because clerical errors happen all the time. We're all human and we all make mistakes. Even though we don't like to, it happens, right? It definitely happens. I've actually had it happen to me personally, where I received a $600 bill for one of my children, and I happen to have twins. And my second son, my other twin, had the same service on the same day. And I said, well, how come it was covered for one and not for the other? What's going on? And it just happened. It was a billing error. It was a clerical error. They sent the claim back for reprocessing, and I never saw another bill. But $600 is an awful lot of money to have to pay when you actually don't have to pay it. So never be afraid to pick up the phone and call. If you do think something bigger is going on, though, please contact Medicare, 1-800-Medicare. You can also contact your local SMP office, which is also housed within the SHIP office, and we can be reached at 410-887-2059. So thank you so much for staying with me for this presentation. I hope that you learned something new. And I also recognize that this is an awful lot of information to digest. If you have additional questions, please feel free to contact the SHIP office. Again, our phone number is 410-887-2059. Or you can also feel free to email us questions at Medicare information at Baltimore County MD.gov. Thank you so much for joining us today. And again, if you have any questions, please feel free to contact the SHIP office.